think we are ready to get started. So thank you so much, Joy and Helen, for being here. I'm going to let you take the lead.
Hello, good afternoon, good morning, everyone. Looking forward to presenting to you a little bit today about the Drug-Free Communities Grant Program and application. My name is Joy Sweeney. I'm the Deputy Director of Training and Technical Assistance and Outreach at CADCA. And I have with me today Helen Hernandez, and she can introduce herself.
Good morning, everyone. It's a pleasure to be here. My name's Helen Hernandez, and I work at the White House Office of National Drug Control Policy, also known as ONDCP, and I oversee the national DFC and CARE grant programs at our office. The DFC program, for those of you that may not be so familiar with it, is a federal grant program that funds community coalitions across the country to focus on youth substance use prevention. I've had the honor and privilege of overseeing the DFC program and working with the DFC program since 2010. And overseeing it at the White House side of it since 2013. So definitely a passion. The work that you all do in your communities is an absolute passion of mine. And we strive to make the application process as fun and as exciting and as easy as we can make a federal grant application. So I just want to set the stage and the baseline there, the expectations. But we have done a lot of work to streamline this application process and this program. So Joy, did you want to bring up the slides?
Sure, I'll go ahead and start sharing my screen and we'll go from the very beginning. How's that?
Sure.
Okay, there we go. All right. So we'll go ahead, and we've already introduced ourselves, and there's us and our titles. So looking forward to, and first and foremost, I do want to mention that at the heart, before I came to CADCA, I am the former executive director of a coalition in the state of Missouri, your neighboring state, but did work with many of my friends and partners in Kansas. So it was always a pleasure to network with other coalitions, community coalitions, doing the good work that we're doing in our communities. And so definitely coalition work is a passion of mine as well. Like Helen said, we wouldn't be doing this for as long as we've been doing it without it being at the heart of the work that we do. So without further ado, I'll go ahead and let Helen get started. Oops, there we go.
So the DFC program, like I mentioned, it's a partnership. It's a partnership between the Office of National Drug Control Policy and some partners. It includes the CDC's National Center for Injury Prevention and Control. That's where the DFC program lives. That's where the day-to-day work around the DFC program happens. I also oversee at ONDCP the National Cross-Site Evaluation, that once you become a part of the DFC family and you start receiving these funds, we want to make sure that we are supporting our coalitions in the evaluation of their efforts so that we can continue to advocate, right, for continued funding for the DFC program to showcase that the program is effective. And then we partner with CADCA, with Joy and her team, for the National Coalition Institute. CADCA is a recipient of a grant from ONDCP to provide training and technical assistance and support coalition development across the country, both for DFCs and non-DFCs through this grant, through this funding that we provide to them. DFC is a little bit unique, and you'll hear me say that a few times because the DFC program sits within a policy office as part of the Executive Office of the President. So the DFC program was created in 1997, and the first set of grants went out in 1998. But it's odd to have a federal grant program in the Executive Office of the President. However, it's really beneficial. The work of our community coalitions serve as a pulse check for what is happening across the country. It helps inform our director, Dr. Raul Gupta, on what is happening, what you all are seeing. So you all are a pulse check. You're the eyes and ears to what's happening across the country. It's unique again in the sense that the funding goes directly from the federal government to our community coalitions. So we don't go through the state. That allows us to put as many dollars, as much of our appropriation out directly to grants to focus on youth substance use prevention. And I think you all are probably familiar with this, but the focus of DFC is to fund community coalitions that are going to try to change the environment in which drug use happens. So we want to change the environment in which a young person comes off a school bus and has to walk home. What are they seeing? Is it alcohol advertising? Is it needles? Is it syringes? What are they seeing? What is that norm for that child? What norms are we creating, right, in our environment that are going to impact that child's behavior? And so we implement and we train on, focus on environmental prevention strategies. But what's most important is that we will not tell you here from Washington, D.C. what your issues are or how you should address them. We really strongly believe that local problems require local solutions. We are here to provide you the resources, the skill sets, the trainings, the connections, the best practices, so that you can do your work. Next slide. The DFC program is a federal grant program. And so again, grant writing can be a challenge, but we first need to ensure that our community coalitions meet the statutory requirements. So just very quickly about the DFC program before I get into the statutory requirements. The DFC program is awards are up to $125,000 per year for 5 years, at which point a community coalition can recompete for an additional 5 years of funding. Therefore, under the DFC program, a community coalition can receive funding for a maximum of 10 years, which is absolutely wonderful. And we have many of the majority of our coalitions, I would say, go through the 10 years of funding. And it's just so wonderful to see how they started and when they graduate out of the program, what changes have taken place in their communities, and just their ability to, their expertise, their ability to be effective is really, really powerful. Within those 10 years, there is a match requirement. We will talk about that match requirement as part of the statutory eligibility requirements. But what that does is it ensures, it's built into the program, so it's a requirement, that our community coalitions are able to match with non-federal resources the amount they're requesting from the federal government. So for example, if you're requesting $125,000 from the DFC program, you would be able to match in non-federal resources the 125. And again, it's not only to help support the work of our coalitions, but it's really to help you build sustainability. We want to see you sustain your efforts after 10 years. And we'll talk about creative ways in which the match requirement can be met. I always say that should not be a reason why your community chooses not to apply for the DFC program. The match is possible. You can meet the match requirement. You just have to be creative about it. And we have resources that, we've developed together with CDC and CADCA to help our coalitions better understand kind of what those, statutory, what that match requirement is, what works, what doesn't. And so we've got creative for you. I'll say that. So the statutory requirements. It is critical that our applicants meet the statutory requirements. If you don't meet the statutory requirements, then the application doesn't proceed right to the peer review process, which is where the application is scored. And so our goal is to always help our community coalitions understand what the statutory requirements are, and that our coalitions are able to check off these 10 requirements, because we want that application read for 2 reasons. One, it needs to be read so that you score high enough and get funded. But if you don't get funded, we have built into the system a process in which applications that are read get feedback, right? They get reviewer comments on the application. And so when that's really beneficial, when your application doesn't receive funding and you're trying to strengthen your application for the next go round. That's important. We want this to be an educational process as well, or an opportunity where community mobilizers, preventionists are able to provide you feedback. So let's take I'm not going to go into a ton of detail on these 10 statutory requirements. However, because I don't want to overwhelm you, right? We have some time to work on these statutory requirements. In addition to that, Abby has a link that I'm going to share or have them share it for me so that you can see the more detailed descriptions of these statutory requirements that we're currently in. We're currently in a funding cycle. So the DFC application is currently out. It's available. The application deadline is fast approaching. It's 12 days, April 11th, before 11:59 p.m. Eastern Standard Time. So if you're writing for this cycle, this is great because you're going to get a quick review of like what these statutory requirements are. If you're not writing for this funding cycle, this is a great opportunity to get started. These are things that you could start working on now that will help you come next funding cycle. So as you know, or maybe familiar, the DFC program requires representation in our community coalitions from 12 very unique sectors. Your coalition at the time of application, so if you don't have them now, that's fine. But when you submit the application, you have to have 12 coalition involvement agreements, essentially. And we'll provide you in the NOFA with a template. But we want to have representation from youth, so an individual that's 18 years or younger. We want to have parents, caregivers involved in the work that we do. Business, who are the local businesses that are advocates and supporters of this prevention message that we're trying to create, this prevention community we're trying to create. Media. Media is one that our community coalitions can oftentimes struggle with, and I'll do this throughout the presentation as I'm talking through the statutory requirements, but I'll point out where people struggle in hopes that you don't, right? So media, we oftentimes have community coalitions struggle with this one because they can't get the local TV station or they can't get the big radio station to sign on to this work. And so that's fine. You all will tell us in the application process why individuals from select organizations are a part of the program, a part of your coalition. And so for media, it can be a church bulletin if you're working in a rural community where there is no large TV station or big reporters or radio station. It could be a church bulletin. If that's the information, if that's how your community is receiving information, you just need to explain that to us, help us understand. Of course, we need schools involved. We oftentimes, when we talk about the 12 sectors, it's the movers and shakers in your community. It's those decision makers, those individuals that can create change and implement new policies to help support this mission. Youth serving organizations, those are easy. Those are your YMCAs, your religious and fraternal organizations. We're definitely trying to ensure that our faith-based community is involved in coalition building. We know they play a critical role in communities, and same thing for fraternal organizations. Let's see, who are my other 12 sectors? Law enforcement. Law enforcement, we want it to be, we know the importance of public health and public safety. And so law enforcement has to be an individual that can enforce the law. So a sworn law enforcement officer needs to be a part of this work. Civic and volunteer groups, healthcare professionals and organizations, state, local, tribal government entities. And then we have number 12, which is other. And really, I like to say that that's a catch-all, right? That is where we are seeing more and more representatives from the recovery community, the treatment community, that are understanding the importance of, like, we've got to stop working in silos. Let's all come together and understand our respective roles, right, in creating healthy, safe, and drug-free communities. So the second requirement is that our community coalitions have to be in existence for at least 6 months. And so we need community coalitions that have come together for at least 6 months at the time of application. And typically the proof for this is a set of meeting minutes. We want to see that the coalition's been in existence for at least 6 months. We want to see that you have representation, that you have community buy-in, that you have these 12 sectors, and that the focus is on strengthening and establishing community collaboration and preventing youth substance use. And so we do ask for mission coalition's meeting minutes to ensure that, you know, those things are in place at the time of application. Again, the DFC program is not a program where once you have the funding, then you begin recruiting your 12 sectors, you begin establishing your coalition. That's got to be in place before. So the next statutory requirement is your mission statement. And like I said, the statute very clearly says that this funding is for community-based coalitions focused on preventing, reducing youth substance use. So somewhere within your coalition's mission statement, those words have to exist. And so without that, we're unable, right, to issue funding towards an entity if they don't have that as their primary mission. Again, that's something you can start working on right now. You can specifically mention the substances you're focusing on. You cannot, but it's got to showcase to us that you are a prevention, youth-focused prevention community coalition. So multiple drugs of use. This is one that is, again, it's a statutory requirement that coalitions that are receiving this funding focus on more than one substance. So you have to mention and talk about how your coalition is going to focus on 2 specific substances. Can it be more? Yes. Can it be less than 2? No. Here are some areas where coalitions don't do well. Right? So they will, for example, have a writing team. And in that writing team, the first writer is going to tell me that alcohol and tobacco are the substances our coalition is focused on. And then when someone else, the other writer is working on that 12-month action plan, I'm seeing marijuana and prescription drug in the action plan. To me, that as a reviewer, we've seen it. It shows inconsistent story. It shows that you're not really sure, right? This is why they don't score well. You're not really, that seems to the reviewer, the coalition doesn't quite know if it's alcohol, tobacco, marijuana, or prescription drugs that are issues in their community. And so where I would avoid, I always encourage you to be specific. Be very specific and have a consistent story throughout your application process. And through your application. Where you can go wrong is when you start mentioning ATOD. You know, we're focused on alcohol, tobacco, and other drugs. Again, that indicates that you're, maybe you haven't done a needs assessment. Maybe you don't quite understand what our local issues are. And so that doesn't typically score well. Or you mentioned we're focused on substances or substance use and just accounting for lots of substances. You've got to be very specific and you've got to be very detailed in your project narrative and your action plan that you're focused on 2 substances. So the next statutory requirement is the national cross-site evaluation. And again, I mentioned the importance of that national cross-site evaluation. And so applicants at the time, this is important, applicants at the time of applying for the DFC program are not required to be in compliance with the national cross-site evaluation. A lot of folks think that they have to, and because they don't have the data points, they can't apply to the DFC program. That is not the case. We will work with you, with our national cross-site evaluation team, to help you be in compliance. You will be required to have 2 years from the time of award, the data for the national cross-site evaluation. And I will say our national cross-site evaluation team, in addition to them being absolutely wonderful to work with and work with our coalitions, the survey instruments you likely have in your community are already compliant with our requirements. In some instances are not, and we can identify ways in which we can support and help you get there. But we collect data from for alcohol, tobacco, marijuana, and prescription drugs on past 30-day use, perception of risk or harm of use, perception of parental disapproval, and perception of peer disapproval. And again, we want you to collect that data on at least 3 grade levels, 6 through 12. And it's every 2 years. Again, at the time of application, you don't have to be in 100% compliance. You don't have to be in compliance at all. You just got to understand that, once you become a part of this program, you will be required to submit this data, and there's support there. The next statutory requirement is you've got to be an entity that's eligible to receive federal funding. Seems obvious, yes, but folks don't quite get it. And there's 2 ways in which you can meet this requirement. So if your coalition is a 501c3 and you can receive federal funding, then you're good. There's going to be instructions in that notice of funding opportunity announcement to help you, provide that evidence, right? That you are a 501c3 entity and able to receive those federal dollars on your own. Now, that's not to say that we don't want other community coalitions that maybe have just been in existence for 6 months and just don't have their 501c3 yet, and that's absolutely fine. So what we've done is we've allowed for the partnering of a community coalition with a fiduciary, a fiscal agent that is acting on behalf of the coalition when those funds are awarded. And so I do have to caution you, and if this is the situation you fall under, you're not your 501c3, you won't be this time next year, right? For application purposes, now's the time to start forging and building relationships with that entity you feel might serve as your fiscal agent. And it really needs to be an interview almost. It really has to be some dating is the equivalent of comparison I like to make, because you have to choose wisely. You want to ensure that the fiduciary is understanding of how this relationship's going to work. Because I'll tell you what happens is the funding arrives and then everyone has a different opinion on how they're going to implement this program, what they're going to do, how it's going to be done, who's going to make the decisions. And that presents a lot of problems that ultimately the community ends up suffering. And so again, the legal applicant is that fiduciary, not the coalition. And so when those relationships just don't go well, it just creates a lot of headaches. And again, ultimately what the entities that suffer is the community that's not being served. So choose wisely when you're choosing your fiscal agent. Start looking for a fiscal agent now if that's the approach you are going to use in applying to the DFC program. There are really strong fiscal agent coalition relationships, and there's also very poor ones. So start thinking through what those responsibilities are, outlining what those boundaries need to be, and having the tough conversations before applying. The next statutory requirement is the substantial support from non-federal sources. All that means is that match requirement, right? So we talked about it. There is a document that I will share through Abby and Joy that we've created to help our community coalitions meet the match requirement. And essentially the purpose of it is to help our community coalitions build sustainability from day one. So as you begin in the program, there's going to be in years 1 through 6, 100% match. And then we're going to start bumping it up because at the end of this 10 years, we want you to be sustainable. So just for your awareness, in years 7 and 8, you're going to be providing up to 125% match. And in years 9 and 10, it's going to be 150% match. Again, volunteer time, your sector representatives' time, the roles that they're playing in the communities, the donated space for your events. Those are all excellent sources to meet that match requirement. Next slide.
Okay.
Sorry, not the next slide. I'm sorry, Joy, got ahead of myself.
That's
Federal
all right.
request.
I'm like, you're gonna skip 8, 9, and 10.
No, I can't. Those are like the more important ones, right? federal request, again, this is a simple one. This is one that you can all meet without a problem. An applicant must not request more than $125,000. It seems pretty basic. It seems pretty simple. And you, for the most part, coalitions don't have an issue with this one. What's important to note, of course, is that as you're building your budget narrative, as you're filling out some of these SF424s, the SF424A, these are standard forms in the application process, that you're doing your budget calculations right, and that there's no instance where in a federal request column, you're requesting $250,000, because I can't do that. I can't award more than 125. Okay. Zip code overlap. So this one can cause some issues or some confusion. And so what the zip code overlap statutory requirement tells us is that there cannot be two community coalitions funded by the DFC program serving the same community unless there is a letter of mutual cooperation, right? So we need to know that we're not just duplicating funding and duplicating efforts in a community. What we need to see is that there's a plan for how two coalitions, or maybe it's 3 coalitions, 4 coalitions, how these coalitions are coming together to focus on a specific community, how they're dividing and conquering, how they're collaborating. And so you've got to identify those potential overlaps with us. That's all this means, is that there is a if there is no overlap, then you say in your application on a piece of paper, you say there is no zip code overlap, and you submit it with your application and you're done. If there is overlap, or then you're going to have to submit a letter of mutual cooperation. And again, that's where you all know best who your neighboring coalitions are and what communities they're serving and which one you're trying to serve. And again, this is an opportunity to not be competitive with your own neighbors. This is not the time for that. We want as many community coalitions in a state to take care of their communities. $125,000 is not a lot. I always encourage you to go small, focus in on what part of town your community is going to be the most effective in, and invite all these other coalitions to apply for the program as well. And so that letter of mutual cooperation is exactly that. And then number 10 is there can't be any, after 10 years of funding, the DFC program is unable to support a community coalition beyond those 10 years. So to receive a DFC grant, a coalition that can apply that hasn't had 10 years of funding. And so all you're going to do to meet this statutory requirement is sign an assurance of 10-year funding limit, where you indicate that you understand that your community coalition after 10 years of funding is sustainable and it's ready to go on its own. So those are the 10 DFC statutory requirements in a very high level, quick nutshell. Those are all things that you can start doing today. Not for April 11th, 2023, but maybe for next go around. You can start identifying your 12 sectors. You can start interviewing for fiscal agents. You can start understanding your needs assessment and determining what are the 2 substances our community coalition is going to focus on with this DFC funding. And so those are all things that you can start doing today. Again, Abby has those 2 documents. One, I want her to send out the link. You can take a look, and we go into these statutory requirements in way more depth online on our training website for the DFC NOFO for this year, for fiscal year 23. You can use that now to start preparing and kind of game planning what your strategy is going to be. But that is not the training you're going to use if you're applying for fiscal year 24. So this website will be updated then. However, it's a good training resource now. It's a great resource now to help you understand what's needed, what the NOFO requests. And again, we look at every year how we can streamline and minimize the number of attachments and things that we need to have and receive from our coalitions. So I mean, I've talked about these 12 sectors, and I know, Joy, to the next slide, you know, sometimes people don't quite understand what a community coalition is. And so for the DFC program, you know, this is the definition for a coalition. It's a community-based formal arrangement. Why is it a formal arrangement? Because there's going to be agreements between the coalition and your sector representatives, those 12 sector representatives I very quickly went over that you see on your screen. There's going to be roles and responsibilities. What am I as a coalition going to offer and support our sector representative with? And what is my sector representative going to support our coalition in? And so that's the formal arrangement. That's the agreement that you're going to enter and submit into, as part of your application. But it's a formal arrangement for cooperation and collaboration, where we want these entities, right, to maintain their identities and to come to the table with their experiences, with their resources, with their skill sets, so that they can contribute to our common goal of building safe, healthy, and drug-free communities. Your more effective community coalitions are those that have your 12 sectors that are a part of the community themselves. Of course, there's a passion for wanting to take care of their community, and have the movers and shakers, right? Those are the folks you want in your communities that can help you and your coalition move forward on making some changes, some policy changes, for example. Next slide.
Oops. Sorry.
What we know is that the DFC program is effective. And I mentioned the cross-site evaluation. We are able to see as a part of our national cross-site evaluation that our DFC funded coalitions are seeing significant decreases in alcohol, tobacco, marijuana, and prescription drug past 30-day use. And we're so proud of that work because we know how hard it is. Again, the National Cross-Site Evaluation Team is not, that requirement should not be something that, again, prevents you from applying to the DFC program, because one, you don't have to meet this requirement and have this data at the time of application, but two, there's going to be support. There's going to be a team to work with you, both at CDC and with our National Cross-Site Evaluation, to help you get and be in compliance with this requirement. But we're very proud of the work of our community coalitions, and clearly they're being effective. And thanks to them, thanks to this National Cross-Site Evaluation, we're able to share success stories. We're able to share that the DFC program is effective. And, you know, I'm now overseeing over $109 million in grants to 745 community coalitions. And so again, I always try to beat that. And so always try to, you know, if 745 is what I funded last year, I'm gonna try to beat 745. So yeah. That's something I'm very excited about. Is it your turn now, Joy?
Yeah, I think so. I think unless you have any more that you'd like to add, I really appreciate how comprehensive the information has been, because I think it's very important to hear from your office, Helen, the Office of National Drug Control Policy in the White House, just exactly what the expectations are and how important your support is to these coalitions. Like I said, as a former executive director, it meant the world to me that I had so many people at the CDC and at the Office of National Drug Control Policy and with the evaluator, the cross-site evaluation team, as well as with CADCA, to help me do the work. And oftentimes I didn't utilize these resources as much as I could have. And that's why I truly appreciate Stephanie and the entire team in Kansas for inviting us to come speak to you today, because it's very important. Oh, you do have one more slide here, Helen. Sorry.
Oh, well, I mean, I agree. Thank you for the invitation. Again, I hope this wasn't, I know I went over the statutory requirements very quickly, but again, we know that our DFCs are transforming communities. We know it. Our national cross-site evaluation is indicating the work not only of past 30-day use by our coalitions, but we're reaching 2.7 million middle school kids. We're reaching 3.8 million high school students. And so we're just so proud of this work. So thank you for the invitation to participate in this training session. And by all means, you can always reach out to Joy or myself. We're happy to be supportive in any which way. If you need this training in more details in a few months, happy to do it.
Absolutely, absolutely. And I'm just going to, some of the information that I have here to provide to you is maybe slightly redundant because it may need to be repeated. So the Drug-Free Communities program partners, as Helen has already mentioned, the Office of National Drug Control Policy, or ONDCP, as we lovingly refer to them as, the CDC, the National Center for Injury Prevention and Control. They are the whole grant management support program. They're where the project officers and the reviewers, all the people that review all the reporting reside, as well as the program evaluation team who oversee the progress reports of the work of the coalitions. And then, of course, CADCA, and we are, as I mentioned, the outreach component. Hence why I'm here today to reach out to people who have yet to apply, as well as the training and the coalition development support resources that you have even before you become a Drug-Free Communities grant recipient. If you are a coalition or trying to form a coalition, CADCA is here to support you. You do not need to be a member. It doesn't cost you anything. As Helen mentioned, we are funded by the Office of National Drug Control Policy to help develop coalitions throughout the United States. We also have an entire international team, but that's not part of this program. But we are here to help you, and you can reach out to us at that phone number, training@cadca.org or nca@cadca.org, to find out more about the National Coalition Academy. We do provide the National Coalition Academy training to anybody who would like to, any coalition members who would like to attend. You don't, again, you do not have to already be a Drug-Free Communities grant recipient to attend the National Coalition Academy. I happen to be in Boston today, where we are providing a National Coalition Academy for about 20 coalitions. And of that, 2 of them are almost done with their Drug-Free Communities grants. One is in year 9 and one is in year 10. And so they're just refreshing the information, getting some more data, networking, and learning how they can really be sustainable in their work, because they've had some new people come into the coalition. And so it's very exciting to see people that far along still wanting to get more information. And then we have 3 coalitions here today that have not received the Drug-Free Communities grant as of yet, and are building up the work in their communities to apply. So it is not a requirement that you already be a Drug-Free Communities grant. It is a requirement that once you do receive the grant, that you do attend this training, but you may also attend it without having the Drug-Free Communities grant. So I'll just mention all of our partners and how the Institute came about. As Helen mentioned, the Drug-Free Communities Act, also the reauthorization in 2002, provided for this institute, the National Coalition Academy Institute, which provides the training, coalition development support, outreach, as well as evaluation and research on all of the training that we provide here at CADCA. And as a rule of the Act, the Institute is to provide the education, training, and coalition development and technical assistance for all coalition leaders and community teams. Again, whether you're a DFC recipient, grant recipient, or not, we're here to support you. So I just really want to emphasize that to the nth degree. Again, probably so much so because I didn't know that. As a former coalition leader, I did not know that and before I received my Drug-Free Communities grant, but it sure would have been helpful when I was applying to know that there were people out there that could support me. And so Helen put in a chat box, or Abby put in the chat box for us, that there is a training there specifically regarding all of the statutory requirements. I read through that NOFO for 3 years in a row before we actually got our grant. And it took a tremendous amount of research, and it's daunting. And so that's why we're here to make this process a little bit less daunting and to demystify some of the things and make it less intimidating for you, because we really want to encourage you to apply. And as Helen already mentioned, we do the grant reviewers provide feedback to your application. So even when you don't receive the grant, and I'll just own it, I submitted it one time and I did not get it the first time. But that we took the feedback that we received, we modified our grant, read the new application, because every year, as Helen said, they streamline the application. They changed the number of pages. The first year it was 30 pages, and the next time I applied, it was only 20. And now I think it might be 10. I think we made it back up to 20, but they change things every single year. So you can't go look at this year's notice of funding opportunity and say, oh, I've filled out everything, I'm ready to apply, because you've got to look at the current one. So if you're waiting to apply next year, yes, go through and read and research and get your ducks in a row, but you have to look at the current notice of funding opportunity to apply appropriately. And I think that's another mistake that some coalitions have made in the past. I don't know if that's accurate, Helen, correct me if I'm wrong, but I think some people think, oh, it doesn't change.
No, you're absolutely correct. And you can tell, because we used to, like, we streamline, right? Based on feedback from the application process. I do have conversations with those entities that don't receive the funding. And I go through their application and we read it together and we review it, and I go over the feedback. And there have been instances where I've had to review an application for this year's funding cycle that was following guidance from the previous years. And I'm like, you don't have a bad application. You just didn't answer or respond to the questions for this year, and that you missed this area and you missed that area. So it does happen. Again, use the website that, Abby's going to share, the training resources for this year's NOFO for research, to help yourself get ready and familiar with the statutory requirements, with what we might be asking for as far as evidence of these statutory requirements. But do not use this NOFO to apply come next year, if that's the case.
Absolutely not. Anyway, so the DFC Act made these requirements of the Institute so that we develop and disseminate evaluation tools and mechanisms and measures and resources for you, and then bridge the gap between research and practice. And CADCA does have numerous practical theorists to translate the knowledge from the research into practical application that you can implement directly into your own community. And we hope you avail yourself to all of those resources. And if you need any help finding them, I know that I could have used some help with that too. Sometimes our website isn't the easiest to navigate, but we're bringing out a new website this year, so hopefully that'll be easier for you in the future. And then our vision at CADCA is a world of safe, healthy, drug-free communities. And our mission is to strengthen the capacity of community coalitions to create and maintain safe and healthy drug-free communities globally. And then every day we train. And that's how we are going about the effort to help you help your community be safe and drug-free. And so here's where we want to transition into the demystification of the Drug-Free Communities Grant. What, why, when. We told you a little bit about who the partners were and who is involved in this. So why apply for a Drug-Free Communities Grant? When and how does your community get started? What support will your community receive? Hopefully we've tangentially touched on some of these topics already, but I'm going to delve a little bit deeper into some of them as to how you can actually avail yourself to, like I said, the resources that CADCA has to offer. But why? So why apply for a DFC grant? Well, as Helen mentioned, we can't come from Washington or Boston or anywhere and say, oh, we know what your problem is in your community. It's XYZ, and here's how you fix it. Absolutely not. And if I've learned one thing from attending all of the coalition academies that I've attended, is you've seen one community, you've seen one community. Every single community, regardless of how similar they may appear, is unique. They're unique in from the position that they're starting from. They're unique in the ways that they address problems. They're unique in the history. They're unique in their perspective at this solution. And so we want you to engage your community in solving these problems. How? By collaborating with your community partners. Hence why we've used the science and the research to come up with 12 sectors. And some communities say, hey, you know what, you should have 13 sectors on there and make it a baker's dozen because you need the recovery community at the table. And that is absolutely true for those communities. And if it's not true for yours, then it's not true for yours. We're not here to dictate exactly how you should do it. We're here to show you and outline for you the best practices and what you need to do to implement those practices in your community, and show you the models that have been proven effective based on science, data, and research, and teach you how to get the data from your local community too, because many times the data is out there. People that are leading the coalition or leading the charge don't know how to access it. So we're here to help you learn how to utilize your resources efficiently and effectively that you already have available, and the national resources that are available to you as well. We want to share the information that we know. Helen and I could probably talk all day about the things that we've learned in the years that we've spent working in this prevention field. It's so important. And so, yes, we can help you tap into those resources very efficiently and very effectively, and help to understand coalitions and how they work and how you can actually help them work effectively in your community. And what community wouldn't want $1.25 million to help them help children? I don't know of any, if you present it in that way. Now, granted, that takes 2 grant applications and they have to be accepted and funded. But basically, the potential is there to get $1.25 million for your community. And yes, everyone can do that. And that's why you should consider applying. And you know what? Just do it. Just do it. As the Nike commercial says, just do it. CADCA's model for community change is to offer the training and coalition development and technical assistance, help you establish coalition capacity by building those 12 sectors and getting champions within each of those sectors. It's one thing to say, yes, we have a parent on our community, but the parent doesn't have any passion towards helping youth stay drug-free. Or you've got a kid that's on the football team that's on the coalition, but has no desire to do the work or share with their peers or work in this field. And they don't need to want to be a preventionist. They could want to be whatever it is, a lawyer when they grow up. That's not the point. The point is that right now they care about helping their peers stay drug-free, and they're willing to stand up and stand out for this goal. And that's important, an important coalition member to recruit. So we help you build that capacity and bring the right people to the table. Coalitions implementing the essential processes, the strategic prevention framework is the next phase of this. And I'm going to walk you through all of this model, but I just kind of want to tangentially touch on some of these things. Pursuing the comprehensive strategies through a strategic and action plan that you develop with your coalition, not you sit at the training and come up with a strategic action plan, or you draft one for the grant, submit it, and then stick it on a shelf and you don't ever use it. These things need to be part of the process that you walk your community through. And then what happens? You see communities gradually change things, and you're like, oh, maybe they did that because we talked about that at our meeting, or maybe they did that because we heard it, or maybe that newspaper article about the training that the youth were doing resonated with the business sector, and they decided to do screenings. All of these things you will see gradually creep into your community, help those environmental strategies to improve population level outcomes. And that's the model, and it works. Does it happen overnight? Absolutely not. Absolutely not. But does it happen? Yes, it does. And as Helen has already mentioned, your capacity building, your 12 sectors, or your 13, if you've got a great recovery community, you want to bring them into the table because they will be vocal advocates for supporting prevention. They all understand the value add that prevention brings to the community. They really all want to be involved, and it's very touching to hear some of those compelling stories from your recovery community as well. But law enforcement, allowing them the opportunity to sit at the table and share community involved policing and share the ways that they can be connected to your community and support your work. All of these, the business sector, media, schools, religious, having state, local, and tribal governments at the table. Your healthcare professionals are essential. And of course, your various civic and volunteer organizations, your Rotary clubs, and other substance misuse organizations or substance use disorder organizations are key essential partners. And obviously, right at the top of this circle are the youth and the parents, because they are our target audience on much of the work that we do. And then, of course, I mentioned the strategic prevention framework. We've got skills and processes. I love this slide because it really does outline the steps throughout the strategic prevention framework that coalitions need to be engaged in. And one of the things we always ask is, okay, why is sustainability and cultural competence right at the middle of this strategic prevention framework wheel? Because they need to be thought of at every single stage of the work. Okay, you don't just think about sustainability when you get to the end and you're looking at your evaluation. You don't just think about it when you're doing your assessment or your planning or your implementation or your capacity building. You think about it throughout, as well as cultural competence. It's key in the work. If you're looking at the through the cultural competence lens right from your beginning, right through your assessment, you will be able to build your capacity with that lens. You'll be able to plan to include members from all different sectors and not omit and not have gaps in your planning. And then you can implement with fidelity the work that you're planning because you've looked at through that lens all the way from the beginning of this process. And then when you evaluate it, you can take your data, see where your gaps are, and start the whole wheel again. And that's why it's a circle, is because it's an ongoing evolutionary process that doesn't have a beginning and an end. It's continuous. And that's why we keep going around in this circle. Once you're done evaluating, then you start assessing your community. How were we effective? We see what our evaluation results are. We see that we're making some impact in our community. What can we do better? What can we do more of? And what are just our little sacred cows that, you know, we love, but they're not really changing the work that we do. However, they may be giving us audiences that we would not otherwise have. So there's always ways to look back at the work that we're doing, evaluate it, and make sure that our assessment next time provides ways to improve on the work that we do. Continuous quality improvement, many things that the business community has been looking at for years. What is our return on investment? Are we getting the most out of the work that we're doing? Or are we just spinning our wheels? Are we being busy or are we being effective? Asking those questions so that the work that you're doing as a coalition is truly effective in your community. And then using the 7 strategies for community change. And Helen mentioned earlier about environmental strategies. Yes, we need to provide we need to provide information and enhance skills and provide support, but we also need to enhance access and reduce barriers, change the consequences in your community, changing physical design and modifying and changing policies. And people are like, oh, well, we can't lobby with federal money. We're not talking about lobbying with federal money. We're talking about local policies And they can be big P's and little P's. It can be a policy that families implement in their home about talking to their children about substances. It can be something as simple as that. And that's a policy change that you could start in your community through a Talk They Hear You campaign or something as simple as that. All of these things can be implemented with fidelity if you understand what it is that you need to do, and using the 7 strategies and being comprehensive in the work that you're doing, and not just, oh, well, we're sharing, we're providing information, creating awareness. That's the big thing that most coalitions start out doing, because that's what they know to do. Great. That's a great start, and that's a great way to get the word about what it is that you're trying to accomplish in your community, but you can't stop there. If you stop there, that's all you're going to do. Everybody will be aware, okay, well, there's a problem. Now what? And that's where we need to make sure that you understand the 7 strategies and how to actually implement them. First, plan for them and implement them in your community with fidelity. And we'll go ahead and talk about the National Coalition Academy that I have mentioned briefly earlier. And what it is an intensive coalition community mobilization process, action-focused training. As you can see, we did this activity today in our training in Boston here, and I love it. And it really does illustrate how communities can work together to effectively do what they need. Teaches the leaders of the community to know what they need to know, and then the process is to actually get the work done and to maintain the effective substance misuse prevention coalitions that can actually take action within their communities and get things done, have outcomes that are effective. Here's a sample training site. We do about 7 to 8 per year. As I mentioned, I'm in Boston. Here's where we are. This is our schedule for this year. We come back 3 separate weeks throughout the year. We give you the training, the information to do your community assessment and your logic model, and send you home to do that work with your community. And then you do that work, and then we come back and meet virtually on a webinar, kind of like this one. And then you come back to the training, and we share, and we move on to the next steps, and you learn how to take that to your community. And that's why this training is required for Drug-Free Communities grantees, because it really does help coalitions understand what it is that they need to do, and not just, okay, here's a bunch of stuff you can read if you want to. It's practical application and implementation of the work to be effective. And it's so exciting to share with your partners. You've got coalitions here that are doing some fun things, and they're sharing with each other, and they become really lifelong career mentors and mentees and partners in the work. It's comforting to know, and it really does help demystify and take out some of the daunting and intimidating aspects of coalition work, because you know that there's somebody clear across the country that's trying to do the same things that you're doing, and you're all doing it for the right reasons, to support and help youth stay drug and alcohol free, help the wellness in your community, and build communities that are safe and drug-free. And here's a little bit, I kind of tangentially mentioned it while we were looking at the schedule, but you come to the training, we do an orientation, you come to the training, then we do a reinforcement webinar in between each week of the training, and then you complete and submit the products that you're going to use to implement the work throughout the rest of your drug-free community grant, or prior to implementing your prior to receiving your drug-free community grant. And then you have coalition development support and a learning management system that's available to you infinitely. And then you go to our National Leadership Forum in February or early end of January and graduate. And the benefits of attending the NCA are to build capacity and impact of your coalition, to network with other coalitions and learn from other coalitions' experience. Apply your training hours to become a prevention specialist. Many of us already are the subject matter experts on prevention in our community, but you don't have the certification. If you don't, the hours through this training would apply for becoming a prevention specialist. We also want you to have fun and know that this coalition work can be a lot of fun. And you can check out the testimonials for yourself on our website at cadca.org/NCA. Here's some of the training. CADCA training is effective. It's proven. We report higher levels of effectiveness. They're engaged in more comprehensive strategies to address substance misuse, and they're more likely to have the essential processes in place that you need to create this community change. And then the other key important aspect, and we're learning this through the evaluation of the work that we do, is coalition development support or technical assistance. As a coalition executive director, I was like, technical assistance, I know how to use my computer. I got this technical stuff down pat. That's not at all what we're talking about. We're talking about actually doing the work. When you're having challenges within your community, or when you're having successes, how do you share them effectively so that others know that you just did this major event and you had 500 youth at this event and it was tremendously successful, and they all decided to form a coalition, or they all decided to commit to drug-free lifestyles, and how we can help others live their best life every day with the work that we do as a coalition leader. And the coalition development support provides support with all of these things: assessment, capacity, implementing and planning, as well as evaluating your work, sustaining your efforts. And what does it mean to identify your communities within your community? We live in a 98% all Caucasian community in a rural town. Everybody's the same. Well, there might be some communities within that community that are a little different. And how can you find them? How are they underserved? How can you help them? And how can you support them? And then prevention tools and resources. As I mentioned, we've got the practical theorists. We've got the what's trending infographics that you can rebrand with your logo. And then how do you engage your coalition in all of the work that you do? And many, many more things. Any questions that you have about writing smart objectives, or about reviewing your objectives with your coalition, and how do you make this engaging? Do you want to sit there and talk at them at every single coalition meeting? Absolutely not. How do you make the work fun? I'll show you the balloon activity. It takes all of 5 minutes and it is super fun. You'll get more people to come back to your next coalition meeting. Anyway, here's our resource page, cadca.org/DFC. And you can find links to, I believe, the training, but that training link is also already in the chat box. There's also many, we'll probably put this PowerPoint on there as well as various contacts at CDC, Office of National Drug Control Policy, and many of CADCA's resources are, of course, on our website. And in summary, hopefully you got the brief history. You learned what DFC was, why you should apply, when and where to apply. We mentioned that the NOFO is open now until April 11th. It will reopen again, probably sometime early next year. Usually it opens the latter part of January, the first part of February, and it's open for about 60 days. It is open for at least 60 days. And then how to obtain and sustain your drug-free communities grant. We hopefully discussed that a little bit here today. And now I'm going to stop sharing my screen and open up the floor for questions. So please feel free to come off mute and/or throw your questions in the chat box.
Thank you, Joy. I do want to mention Helen had to leave for another meeting, but we do have a couple questions in the chat. The first one was about the slides that you shared specifically, but I think that you mentioned that the slides will be available on your CADCA DFC website.
Yes, they will be. Thank you. And also I can email them to you, Wendy, and you can send them out as well.
That would be great. Yeah, thank you.
Okay, sure.
Okay, we have a couple questions in the chat. The first one is, would you mind giving some examples of data sources that coalitions can use for their needs assessment and evaluation plans? Absolutely,
absolutely. Many health departments have several different, and every 3 years, hospitals are federally required to do a community health needs report. Or CHIP, so community health improvement That's what it is. Anyway, so basically I would reach out to your hospital, reach out to your health department, reach out to your schools. Law enforcement also has some great data on what was it? Accident reporting data. There's a myriad, and we do have a list of those are just 4 or 5 off the top of my head, but the school student surveys, I know that Kansas has Kansas student survey data as well. Yes, many schools, I know in Missouri, the schools had to opt in to receive those, and sometimes there were a few years in there where the schools had to pay for them. So we had to go in, talk to the school board members and say, look, we need you to continue to administer these surveys so that we can get this data, because it's a requirement of us receiving this funding. But if you explain to them the value add for them, they're most often very willing, and schools are one of the sectors that you truly want on your coalition and involved in the work that you're doing, because ultimately it does improve their graduation rates. It does improve attendance. It does improve the work that they're trying to do, which is educate our young people. So yes, there's a list. I think if you can email me and I can give you the resource list of many different, it varies from state to state because some states are more comprehensive, but usually county-wide data as well is very helpful in obtaining really localized data. But even now at the federal level, we're drilling down. I know that I was looking the other day on the opioid overdose deaths, and we're able to get statewide data at the national level, but then within the state, you can drill down to the countywide data, how many deaths there were by county. And so that's just one of the many ways that I know of. Anyway, yes.
Thank you. Our next question is, what is the approval process or criteria like for proposing EBS that aren't on a national registry?
Oh, absolutely. We understand that evidence-informed data and many of the national registries are so outdated. So there are evidence-based practices that aren't on the national registry. There are also evidence-informed strategies that are effective, and we're well aware of them. And so I think one of the things that many coalitions are intimidated by is that, NREP, you have to have 7 years of data and research behind it, that you can't get your programs evaluated. Well, there's also higher level theoretical data that we have now in prevention science that shows that if you're involving peer-to-peer education or even near peer-to-peer education in the work that you're doing, that it's effective. And so and not just effective locally, it's effective environmentally, and it expands beyond just your community as well. And those tangential aspects of that are important too. So don't let the National Registry requirement inhibit you from applying. So that's all I have to say about that.
That's good. Can DFC funds be used to support all ages or only youth?
They're primarily used to support youth, but yes, they can support, they're for creating environmental strategies. And environmental strategies, one of the things we like to liken it to is the numerator versus the denominator. If you're only supporting youth in your community, that's the numerator. It's not the denominator. The denominator is the entire pond or the entire community. So absolutely, it will impact. Ultimately, those youth become adults at some point. So over 10 years, if you're starting with an 18-year-old, are they going to be 28 by the time you're done? Yes, they are. And so, yes, they can support everyone, but the focus and the emphasis has to be on reducing youth substance use, because we know that ultimately by creating an environment that reduces youth substance use, it will reduce adult and senior and all of those levels. Can you do a specific program for senior citizens? Yes, but you might want to get support from your community. Hence, that could be a match. that could be a way that you bring in additional outside funds to support the work that you're doing as well. If we had a drug-free communities grantee that's at this training that I'm at right now, that when they looked at their data, seniors over 55 were some of the highest population that were dying from opioid deaths. So what could they do to reach out to those seniors to make sure that they could mitigate that? And so, yes, and they were using, at least in some part, at the administrative level, using drug-free communities funds, but they also brought in matching funds to help support their efforts to address that concern.
I love that analogy, numerator and denominator. That's a good one. Our last question in the chat. So if you have any questions, please send them or feel free to unmute yourself. Is, can DFC funds be used to purchase fentanyl strips and naloxone?
You know, that's a great question. Fentanyl test strips, I don't think so. And naloxone, I think it might be borderline. Again, depends on what the NOFO comes out with next year. Right now, we're trying to focus on prevention, primary prevention mostly, but we understand that we can't help with primary prevention if people aren't here. So, you know, it's across the continuum that we're working, and prevention across the continuum is important. We want to make sure that people understand the work that we're doing. Again, it's a great way to integrate match. It's a great way to bring in other partners. Like I said, the recovery community, the 13th community, the 13th sector, and your coalition can help you with those aspects of prevention. And yes, many coalitions are doing those things, but they're bringing them in with outside resources. I don't think that at this point in time, I'm positive you can't buy fentanyl test strips. Not so sure about naloxone, but many places are giving you naloxone. And I know that CADCA at some point was able to provide over 10,000 Narcan nasal spray pieces, whatever, I don't know what you call them. Over 10,000 nasal spray distributors. Anyway, so definitely try and get those things as match and donations from various sources. And if you need help with those resources, that's another thing that we can help you with.
Great, thank you. I can tell you really know your stuff, so it is really, really great that you've been here to do this presentation.
Well, I really am passionate about this, and I've been doing it for decades. You know, I've been around for a minute, and I care. And I was just going to be the executive director of this coalition part-time many, many moons ago. Next thing I know, here I am still hanging around because I can't stop doing this good work that we do, because I know how valuable it is. And I know how daunting it can be and how intimidating when you first come into it. It's like, really? I read the first, it was an FOA, funding opportunity application. And I was like, it's 180 pages. I don't even know.
Yeah.
I don't know what I don't know, but it is, there are people that are here. We're here to hold your hand. We're here to walk you through it. We're here to help, and we want to help, and not asking for anything in return other than that you keep doing the good work that you're doing. And I know that many times you can't even apply for things because you're so busy doing what you're already doing. And we don't want to take away from that. We value that, and we understand how important that work is as well. So yeah. Thank you all for being here today. I know that it was a time commitment, and I'm grateful. Yeah, thank you. Everyone, if you'll please fill out the demographic link if you haven't already. This recording will be available as soon as possible, and all of the resources shared today. So thank you again, Joy. I really appreciate your time. It has been wonderful. It's been my pleasure. Thank you, Abby, for having me. As I mentioned before, I truly appreciate the opportunity. Yeah, thank you. Have a great day, everybody. Yes, make it a wonderful one. Thank you.